Thanks, Chuck. Thanks, Nathan, as well. And thank you all for being here. I know having an event like this in the middle of the week, you've had a long day probably in working, and maybe you just wanted to go home, but instead you came and joined us, and I really appreciate that. I'd like to really talk about a kind of an innovative way to approach things, and we call that Medicare for Employers. I started Health Perspectives about 3 years ago. I think Chuck mentioned that I left corporate America and started out my own firm, and I kept bumping into these organizations that are either directly or indirectly involved in Medicare. And I was on Medicare myself, so I was seeing it from the inside, and I really viewed that there was a tremendous opportunity and a strong vested interest among employers to really grab a hold of this concept called Medicare and see how it could be not only helpful for their employees who are over 65, but also helpful for the corporation as well. And that's really what we're here to talk about. So we'll start off by talking about what we call the healthcare squeeze. And many in this room are probably familiar with this competing tension that exists between trying to get a handle on these surging healthcare costs and meeting the healthcare needs of the employers. And those are both important, but they're really a tension between the two. So let's talk about those emerging trends. I've mentioned that a couple of different times. When you boil it down, there are three major trends. None of these should be a surprise to the people in the room. The first is employees are getting older. Why is that? Our society is getting older. The average age is going up. So employees are following that trend. Those employees are working longer. They're doing it for a wide variety of reasons, but there's a hidden reason that's now emerging that I'm going to expose tonight in this discussion. Medicare is getting better. So a quick overview of Medicare itself, available to all Americans when they turn 65. It's interesting that many people have a misconception that Medicare is for people who are retired. That's not necessarily true. Medicare was formed for people over 65, whether they're working or retired. There are a lot of different components to it. People use the term Medicare, but many people fail to understand there's a lot of different components to it. There's the alphabet soup that's behind me. A is for hospital charges, B is for physician charges, C is for Medicare Advantage, D is prescription drug, and then Medicare Supplement covers what A and B don't cover. The right combination of that alphabet soup is going to vary from one person to another. Medicare options vary by county. So what's available to you here in Mecklenburg County is not available to you in Union County. There are many nuances about Medicare that have financial consequences. And this was an eye-opening experience for me when I joined. So when I started working with individual people on Medicare, I had a friend who, very bright guy, had been in healthcare for a long time. When he retired at the age of 65, he got Part A and Part B, but he didn't get Part D, which is prescription drug coverage. Why not? He wasn't on any drugs. So in his logical mind, why do I need coverage for something that doesn't apply to me? The problem with that is he got older, and he had a need for drugs. And he went to apply to get prescription drug coverage. Well, he learned that he was going to have to pay a late penalty. And that late penalty was going to be with him for the rest of his life. All of the above leaves many who are 65 confused, overwhelmed, and lost. And many of them work for you. So let's talk about why employers should care about Medicare. There are three key reasons. This is the first one. It can be better for the employee or for the dependent that's over 65. It depends upon their situation, but in general, it can be better for two reasons. Better coverage. So if you're a business leader and you're concerned about your company and your employees, when you try to find a group health plan for your company, you really need to think about all of the people affected by that group health plan. And it's not just your employees, it's the dependents as well. So when you think about the age span, if I put out my arms, it's from people my age on one end and newborns at the other end, and everyone in between. So the employer has a great challenge of how do I do all things for all people? It's not an easy thing to do. Well, Medicare doesn't have that problem. They're not worrying too much about pediatric care and NICU days and pregnancies and various other maternity-related costs and issues. They can focus just on the other end of the spectrum. It's also better in terms of the costs. So when you think about it, if you can just focus on a segment of the population, you don't have to worry about those NICU days, that's going to provide some cost relief. Also, all of us in this room and the employers we represent have been paying for Medicare for as long as we've been working. When you started working, you were paying a Medicare payroll tax. And so you've been funding Medicare all the way. So that's taken into account when it comes time for you to join Medicare many years later. And then last but not least is the unleashing of Medicare's buying power. You may be aware that just recently, Medicare has the green light to negotiate directly with prescription drug manufacturers. So what does that mean? I'll put it in practical terms. You may be familiar with a drug called Eliquis. It's a cardiology medication, very important, very needed, but very expensive. The list price for a 30-day supply of Eliquis right now is $590. Next year, it'll be $260. Why? Because Medicare can negotiate now. Up until now, they haven't been able to do that. So that's one of those macro trends that's happening that's going to have an impact. So don't take my word for it. Let's look at a survey that was done in 2023 by the Kaiser Family Foundation. They interviewed 3,600 Americans and asked them what their impression was of the insurance that they had. All different types of insurance, Medicaid, group health plan, Medicare, a variety of different types. And here's what they found out. When they looked at the overall performance of that current insurance, here's the results comparing Medicare and employer-sponsored care. The people on Medicare like Medicare a lot better than the group health plan. Again, the group health plan is trying to do all things to all people. It's not easy to do that, whereas Medicare can focus on just a segment of the population. All right, reason number 2, while employers should care about Medicare, it's growing. This population, as we talked a little bit before about the macro trends, is growing, and it's growing very quickly. So these numbers that I'm about to give you come from the U.S. Department of Labor. And we look at 2022, about 7% on average of a given workforce in the United States had 7% of the people were over the age of 65. In 2025, the year we're in right now, it's crept up. It's now at roughly 0.5% higher. But let's look at 2030. It's about to jump big time. So almost 10% of the workforce is going to be over the age of 65. So now it's becoming more important for employers to think about this population that's still working, probably very valuable employees, but also very expensive employees as well from a healthcare standpoint. So what's driving this increase towards 10%? Well, there are a number of reasons, but one that may not be fully appreciated is something we call the Social Security gap. So on the far left-hand side, you'll see years listed there, and that represents when a person turned 65. The second column is when they became eligible for Medicare. It's always been 65. You can see a consistent number there. But that's not true for Social Security. It used to be 65, but you can see that's changed. And then on the far right is the gap between Medicare and Social Security. Prior to 2008, if you walked off the shop floor or out of that office building for the last time because you had just turned 65, you left being assured that I've got my coverage for healthcare, Medicare, and I've got full employment, Social Security income. I'm in good shape. Well, Congress figured out that Social Security was losing money and couldn't keep up with this. So back in 2008, they said, you know what, we're going to push out that full retirement income on Social Security for a year. They did it all at once. So from 2008 to 2019, you had to wait a year. So now people are thinking, well, you know, maybe I should work a little bit longer because I want to get that full retirement income. Well, we got to 2019 and Congress said, we're still losing money out of Social Security. So we need to do something. But now we're going to push it out, but we're going to do it in a phased approach. We're going to do it over 6 years. So this year, 2025, is now a 2-year gap. So people are going to be working longer because, yeah, I got my Medicare coverage, but I'm not going to get my income that I was counting on because we got pushed out. There's no talk in Washington of changing the Medicare number, 65, but Social Security is still struggling. So I wouldn't be surprised if it's going to go beyond 2-year gap. It's going to be more than that in the future. So So what does that mean for employers? Well, it's a threat, because now you've got more high-cost people that are working longer in order to achieve that full retirement age, and that's going to have a negative impact on your budget, particularly as it grows to 10% of your population. But there's an opportunity, and the opportunity is if those employees decided, you know what, I think Medicare is actually better for me than the group health plan, then you may be able to keep these really valuable employees but lose the cost of having those employees when it comes to healthcare. They may just go to Medicare, and you've got the best of both worlds. Valuable employees, I don't have their healthcare costs. So reason number 3, as I mentioned before, this population is very expensive. How expensive? Oh, about 2.5 times more expensive. When you look at the annual healthcare expenditures for people over the age of 65 in our country, it's about 2.5 times what the cost is for the working age population between 19 and 64. So what does that mean? Well, what that means is by 2030, you're going to have 10% of your population that's causing you 20% of your healthcare budget. So what's the solution? What's Medicare for employers? Well, we believe there's an approach here that can help bridge this gap and reduce the healthcare budget. And there are 2 components to it. There's the corporate Medicare game plan. That's the macro approach to what's unique about this company, and therefore what approach should be taken to address the issue that we've just been talking about. The Medicare Advisory Services, that's the micro perspective. That's working with one-to-one with people who are approaching 65 or already there. What's best for them? What's the right plan? Because remember, they're feeling overwhelmed and confused and lost, and they need some professional guidance to do that. So let's go a little bit deeper into the corporate Medicare plan. It starts with a corporate analysis. What's unique about this company? What's the culture like? What's their strategy in terms of attraction and retention, particularly when it comes to older personnel? What are their profiles? Where do they live? As I mentioned, county by county, it's going to be different in terms of the solution. So you have to know where your people live. What are their profiles? What's the claims history like for the older population? That translates into a written game plan, a corporate Medicare game plan on how the uniqueness of this company can address the issue that's associated with that population over the age of 65. It then converts into group level information, Medicare 101 webinars and meetings, communication materials that are massively distributed, educating, informing, getting people comfortable with the concept of, got other options here now beyond the group health plan. So then you have the individual analysis, the personal analysis. What's important to them? What's their lifestyle like? Do they travel a lot? What kind of issues are they grappling with? Very personal information to figure out what is the right solution. It could be to stay on the group health plan, or it could be to go to one of the Medicare options. And so part of that discussion is comparing coverage options between what is your group health plan now and here are some Medicare options that might be a good fit for you. And that support is ongoing. Even after they leave the employer, that support from a licensed Medicare advisor is there for them at all times. When I left corporate America, I had just turned 65, and I made 2 mistakes. Number 1, I assumed that my coverage in the group health plan was better than Medicare. I was wrong. I was on a high deductible plan, and boy, I reached that high deductible level. And then I'll talk about a comparison between the 2 as we go along here. The second was that, well, it's got to be cheaper. It's got to be less expensive because after all, my employer is paying 75% of the premium. Well, that was true, but that's not your total cost. Then you have the deductible and coinsurance and copays beyond that. And so when you add all of that, I would have saved $1,000 a year if I had gone to Medicare when I was 65. My employer said nothing to me. Didn't even remind me that I had this other options that were out there, and I made 2 bad choices, assumptions along the way. So I'm going to give you an example here. I'm going to create a scenario and make some assumptions. I'm assuming that there are 500 employees, and with that size, they're probably self-insured. I'm assuming that this company follows the national averages when it comes to what portion of the workforce is over 65. It starts with 7.4% in 2025 and grows to in 2030 to almost 10%. I'm also assuming that roughly half of those people are going to have a spouse that's also in the group health plan. The second to last assumption is that I'm going to assume that starting in 2025, when properly informed and educated, that about 25% of those that are eligible will move over to Medicare. But that number will grow because remember, these people are still working there. And if they're still working at this company, they're now starting to tell their friends about, you know what, Medicare is a pretty good deal. And that percentage will grow over time. And then finally, I'm going to use national statistics in terms of what is the employer's cost when it comes to people that are over the age of 65. So with that being the assumptions, let's take a look at what that means. This year, 2025, there's the 500. At 7.4% of that population, that's 37 people over the age of 65. But half of them have spouses that are also over 65. So if you add those, we're now talking about 56 lives. Well, if 25% of those switch to Medicare, that's about 14. And if the employer cost per 65 plus life is $15,000, potentially you're talking about saving $212,000. Well, what happens in 2030? Remember, you've got this trend that's moving up from 7.4%, closing in on 10%. Well, now that same 500 employees, now there are 48 people that are over 65. Half of them have spouses that are over 65, so now we're talking about 72 people. If there are now 35% of the people making the switch because they've been hearing great things from their coworkers, and if $19,000 is the number with a 5% inflation trend, now you're talking about $500,000 that goes to your bottom line. All right, so a quick summary slide. Medicare in many cases offers better coverage for the employee and does it for an employee segment that is growing rapidly. It's a very expensive population. But when the solution works, there's an immediate impact. When that person decides, okay, I'm leaving and I'm going to Medicare, that cost is gone. So therefore, it reduces your healthcare budget, and it does it with a very modest investment on the part of the employer. Last slide. So my contact information, I showed you that example of the financial impact for that fictitious 500 employee organization. Well, if you want to apply that to your own situation, how many 65 plus employees you have, how many total employees, maybe you know the cost for those people over 65. You can use that QR code. You can do it right now if you wanted to. You can go there. It'll bring you to our website, direct you to the cost calculator. You plug in your own numbers. You will see the impact potentially there.